you have to suspect severe, if their patient has severe abdominal pain, pyrexia, extra care should be taken to rule out other causes of abdominal pain symptoms. And the management basically based on the type of the symptoms, that is the based on the classification of the severity variety, that is mild to moderate, very very important. The outpatient management, I already told, OPD basis management will be mild or moderate basis. I told what is the mild and moderate. Mild is abdominal pain and crampings, and there will be a no ascites. Moderate is just starting ascites, and severe variety is there will be a oliguria, hematocrit is more than 45%, hyponatremia, hypokalemia, every possible complication will happen from the severe variety of OHS. So that has to be severe and critical, has to be the teens ascites, gross ascites, and thorax, hydrothorax, that has to be managed properly. Okay. So basically the outpatient management is appropriate for women with mild or moderate OHS. So selected case with severe OHS also manage outpatient, but basically you have to remember mild and moderate cases OPD basis. Then what management is appropriate for outpatient case with OHS? Women outpatient management should be appropriately counseled, provide the information regarding the fluid intake. Basically the outpatient management is only the fluid intake and output monitoring. In addition to, they have to access to advice. Very very important statement here, NSAIDs to be avoided in case of, these are the very very important question that you ask, because you should avoid because that will cause a renal function impairment. So you should not give NSAIDs, because but you can give, but instead of NSAID you can give morphines or codeines or paracetamol as the analgesic of choice for these patients. Okay. Another statement they have told, women with severe OHS, very very important, women with severe OHS being managed on outpatient basis, they should receive thromboprophylaxis with a low molecular weight heparin. The duration of treatment should be individual, taken with the risk factors whether not a conception occurs. So based on that you have to decide, but they have to give low molecular heparin treatments. Okay. So severe variety, the starting you have to start low molecular weight heparins. Okay. The paracentesis of ascitic fluid may be carried out on an outpatient basis by the abdominal or transvaginal route under ultrasound guidance. So very very important, the paracentesis. The paracentesis of ascitic fluid may be carried out on an outpatient basis by the abdominal or transvaginal route under ultrasound guidance. So basically the paracentesis should be done outpatient basis. You have to do an under ultrasound guidance, because the ovarian size is large, so sometimes you may rupture the ovary. So there is insufficient evidence of whether you could use, there is no evidence regarding the GnRH agonist or antagonist or dopamine agonist. Dopamine agonist used to treat established OHS, there is no evidence. Okay. GnRH antagonist or dopamine agonist like cabergoline, everything. Okay. Then the women with OHS should be managed on outpatient basis, should review urgently if they develop symptoms. They have to explain regarding the, if there is a mild and moderate OHS, you have to manage OPD basis. So if they have a symptoms of worsening symptom, they have to come to the hospital. So they have to review every 2 to 3 days. The baseline investigation, already told what are the baseline investigation shows up to send, the like CBC, the electrolyte, LFT, RFT, TFT, LFT, RFT, and the D-dimer fibrinogens, and the thromboprophylaxis for the thrombin in this test they have to send. And sodium potassium levels you have to check for that also, and CRP and WBC count, everything has to be, the baseline investigation has to be there. The hematocrit is the very very important statement. Hematocrit is the very very important things to monitor the response of the treatment, monitor the response also and the severity also, because the intravascular volume depletions is more in case of severe variety and critical variety of OHSS. So that cases you have to monitor the hematocrit. It usually useful to guide the degree of intravascular volume depletions. So very very important is hematocrit, because you know 45% in the severe variety and the critical is more than 55%, because gradually the concentration will be increased, because in the critical there will be more fluid effusion than the gross ascites. In the inpatient management, when should be women with OHS should be admitted, very very important. They can ask any type of questions regarding the hospital admission should be considered for women who are unable to achieve satisfactory pain control. First thing. The second is unable to maintain an adequate fluid intake due to nausea. Suppose they have a nausea, they are not able to take a adequate proper hydration, because intake output charting in the mild moderate cases in the OPD basis management very very important. So first statement is unable to achieve pain control. First is pain, then dehydrations, it's not achievable in home. Then second is signs of worsening symptoms, signs of worsening symptom. What are the worsening symptoms? Already I told worsening symptom is oliguria, anuria, hyponatremia, hypoproteinemia, and these are the gross stain society. These are the worsening symptoms, respiratory distress symptoms, and cardiogenic failure. Every multi organ dysfunction signs are though these are the worsening OHS despite outpatient interventions. Okay, so first is pain, second is hydration, third is your signing of worsening, fourth is regarding your admissions, unable to attend regular not follow up, then you have to admit the because you have to know the distance from their hospital, and already they have a critical OHS. So these are the condition you have to admit the patient. In patient management has to be done. So very important. They can have multiple choice question, they can give multiple questions. Okay, you have to remember first is pain control, hydration is not able to control because of nausea, then OHS high risk of signs of worsening, unable to attend regular follow-ups, and critical OHS. Then you everything's up to, because this is like complications of multi-organ dysfunction, so you have to go with multidisciplinary assistance should be sought for the care of women with the critical OHS and the severe OHS who have a persistent hemoconcentrations and dehydration. So this overall it is a multidisciplinary approach. Okay, the feature of critical OHS should prompt consideration of the need of intensive care out. So critical OHS already is they should be go to ICU for the management, because this is a multidisciplinary team. The clinician experience the management should remain overall charge of the women care. How should women with OHS monitor? They should be at least once a daily. This should monitor. The frequency is based on the critical conditions. Then very important statement I already told, analgesia, antiemetic may be used but avoid NSAIDs. You can give morphines, codeines, and paracetamols as a drug, and those drugs already contraindicated in pregnancy, that has to be avoided. What is the appropriate management of fluid balance? There is no, you have to give by oral route, guided by thirst, the most physiological approach to correcting the intravascular dehydration. So how you will give the oral fluid balance? Like you have to give oral route only. Okay, most probably, but mostly you have to go. But if there will be a persistent hemoconcentration despite volume replacement with intravenous, despite volume replacement you are giving oral replacements, still there will be a persistent oral. Then if persistent dehydration, then you have to add IV colloids. Very important statement. Okay, then maybe invasive monitoring needed, should be managed with anesthetic input. Diuretic, very important. Role of diuretic only if there will be a critical OHS, that is severe variety of OHS, that is it should be avoided because again the diuretic, why you should avoid diuretic, because again it will cause depletions of intravascular volumes. So in case there will be severe dehydration, severe oliguria, because there will be no renal output or anuria, in that case only you have to use the diuretic, only use in severe oliguria, that is your critical OHS. In critical OHS there will be oliguria because severe intravascular depletions, so that case there will be no renal output, that case you have to give diuretics. Okay, or else you should not give diuretics. Okay, next, how the ascites and infusion would be managed. The ascites and infusion, the indication of paracentesis already told, the abdominal distensions and the abdominal distension, abdominal pain. So first point is that indication is distension and pain due to ascites, the first indication. Second is the distension, because of distension that will cause a shortness of breath, respiratory compromise. Secondary to ascites and increase abdominal pressures. Okay, these are the pressures. Okay, third point is because of pressure, despite you are giving third point is to do paracentesis, oliguria because of pressure effect, or because of secondary to increase abdominal pressure causing reduced renal perfusion, decrease renal perfusion because of increase abdominal pressure. So basically these are the indication of the paracentesis. The first thing is severe abdominal distension, that will cause pain, and then again the abdominal distension cause respiratory difficulty, shortness of breath, respiratory distress, that will due to secondary to intra-abdominal pressure, ascites or increased intra-abdominal pressure. Third point is because of intra-abdominal pressures, that will cause a decreased renal perfusion, that will cause oliguria. Because of oliguria I have to do paracentesis, because it is not because of decreased secondary ascites. Okay, always try to do paracentesis under ultrasound guidance, because there is gross ascites, you should injure something, so you should go for a abdominal or vaginal route. And IV colloid therapy, consider those who have a large volume of fluid removed by paracentesis. Suppose they have a go for a IV like fluid, if you remove 2 liters, then you have to replace that volume, because sudden hypertension can happen during these procedures also. How should the risk of thrombosis is managed? Women with severe or critical, very very important, the LMWH prophylaxis I told, from severe and criticals OHS you have to start. They should receive LMWH prophylaxis. The duration should be individual because they based on the risk factors. Women with moderate OHS should be evaluated for predisposing risk factors for thrombosis. Prescribe either anti-embolismic stocking or LMW if indicated. But in moderate, you have to decide based on your risk factor. Not always indicated, but in severe and critical cases, severe and critical variety of OHS, you should start LMWH. But in moderate cases, you have to evaluate the predisposing factors for thrombosis and prescribe either anti-embolismic stocking or LMWH if indicated. In addition to the usual symptoms, signs of venous thromboembolism should be suspected in women with OHS who present unusual neurological symptoms, even if they are present several weeks after apparent improvement in OHS. So very very important question they will ask. Suppose they have unusual neurological symptoms, that is headache, sudden headache, blurring of vision, these are the symptoms, then you have to suspect venous thromboembolism. So these are the in addition to the usual symptom signs of venous thromboembolism, that is the calf pain, thromboembolism pain, leg pain. Again, in those patients with unusual neurological symptom, that case also you have to suspect venous thromboembolism, they have told. Very very important statement you have to remember. Okay, the next is, when is the surgical management indicated? The surgery is only indicated in patient. Surgery is only indicated those patients with next three indications. I will tell the three indications for the surgery. What are the three indications for surgery? Is first indications. What are the surgical indications for surgery? First is your torsions. If there will be a adnexal torsions, ovarian torsions, that's the first indication. Second is your ovarian ruptures, because of the size is enlarged, that will cause rupture of ovarian. The third is your ectopic pregnancy. So these are the indications of your do emergency surgery in case of OHSS. So basically you have to remember these are the point in OHS so that you can never forget. Surgery is only indicated in patient with OHS there is a coincident problem with such adnexal torsions, ovarian ruptures, ectopic pregnancy. They should perform by experienced surgeons. Okay. Then OHS and pregnancy. What are the link with pregnancy with OHS? There should be informed if they have developed OHS during pregnancy. They have to inform that they are increased risk of preeclampsia and the preterm delivery. I just left some things, that is the clinicians, patient should be vigilant. The patient should be vigilant signs of the severity of the, what are the worsening sign I told, is sudden increase in the abdominal distensions and faint, shortness of breath, tachycardia, hypotension, reduced urine output less than 100 ml, 1000 ml 24 positive fluid minus more than 1024 hour, weight gains, increased abdominal. So basically you have to measure all this, increase hematocrit to this 45%. These are the indications, that is the worsening sign of OHS. Already told the satisfactory pain controls, fluid intake, inadequate fluid intakes, despite worsening signs of OHS, unable to follow critical OHS. These are indications. So these are the things you have to remember. OHSS. So overall OHSS management very very simple. The mild and moderate case is managed by OPD basis, and the severe and critical variety has to be managed in the IPD basis. What the indications I told, basically you have to remember the NSAID has to be avoided, diuretic has to be avoided, only the severe and critical case you can give LMWS, only in the severe and critical case, unless it is a risk factor is there. In moderate case you also use the indication of paracentesis, you have to remember. Hospital admission also remember. Pain control fail, nausea vomiting के लिए जो fluid intake नहीं हो रहा है, signs of worsening symptoms, regular fall off नहीं हो पा रहा है critical OHS में, you have to admit the patients. And the provide care in the paracentesis has to be done those patients with severe abdominal distension, that will cause pain, oliguria and respiratory distress because of intraabdominal pressures. And the indications of the IV colloid is large. After the paracentesis you have to give IV colloid fluid therapy. And LMWH, these factors already told, so the duration of LMW should be individualized. And surgery is ovarian torsion, ruptures, ectopic pregnancy and pelvic infections also. Another things is a pelvic infections, and there should be explained regarding the risk of eclampsia, preeclampsia and preterm delivery. Thank you. If you like this content, please subscribe my channels. Thank you all. Good night. Have a good day.